what I'd like to do is maybe talk a little bit about what's going well, or what are some of the best practices you're feeling with respect to hiring and retaining staff.
I would say just having enough leadership to have a lot of emphasis on retention and recruitment. You know, those activities in small places like human resources here, you know, is a department of one. Everybody does their own, you know. So that, you know, presents its own challenges, but I think that engagement, as you said, with the staff themselves, those who've worked here for years and those who've just come on board, we started utilizing a new hire survey, so almost like a 30, 60, 90 day type approach. So, you know, your orientation is fairly set, right? This is what we know we want to do, but I also recognize that depending on people's backgrounds and their experience, you know, I might have a new graduate who actually did their preceptorship with an RN who did their preceptorship with a social worker in the community. Like, that's the type of things that I'm then taking them and you know, building them and mentoring them to manage a full patient load as part of their orientation, right? So those are kind of it becomes more mentoring and learning than it does just an introduction to a new organization and, you know, and a new mission, vision, values, and your strategic directions and all of those other things and new colleagues. There's so much more to it now, I think, than maybe there was previously. So I do think that engagement is huge. The ability to get feedback anonymously, I think, is important, particularly in an organization that is small. You know, people want and have voices and they want to be heard, but they don't always want to be the voice in the room while everybody else is sitting around a table, right? And, you know, I think that we've all probably experienced where, you know, you have meetings and there's 3 people who do all the talking and others do all the listening, you know, and that's not really engagement, right? So that's certainly a strategy that I think has been helpful for us to really sit down and learn. And, you know, the variabilities between the departments and the programs and the insight that new people bring, you know, based on their own experiences elsewhere, I think is important to really tap into.
Great. Thank you, Mary Ellen. Shelley, what would you say?
So very similar. We also do an onboarding survey, and really what I'm trying to tease out there is, why did you choose us? So that we can emphasize whatever that is and, you know, try and understand that. We have a mentoring system as well, a very comprehensive orientation program. You know, probationary performance appraisals. So there's lots of support in terms of expectations and additional orientation if needed. And, you know, and then all of the ongoing stuff, you know, I wish we had more managers for sure, because that one-on-one support and feedback on a, you know, day in, day out basis is so important. So that's always a challenge, but we did move to a new, I say new, like 5 years ago, format for doing ongoing performance appraisals. So we only do performance appraisals on probation and if there are identified performance challenges. Otherwise, we utilize a concept called rounding. Like, I think everybody knows what rounding is like when healthcare professionals do it with patients. But when a supervisor does it with an employee, it's more informal and it's more about, how can I help you? Do you have the tools, the equipment, the knowledge, the skill set, et cetera, to do your job? It asks them, you know, if they could change one thing, what would it be? Every half year we do it twice a year now. And they're just hallway meetings because, as Mary Ellen said, it's that one-on-one, that different than, you know, a departmental meeting, staff meeting where somebody might be too shy to speak up or whatever, or even to go to their supervisor's office and ask a question. Whereas if their supervisor goes to them, and if they work straight nights, then it means they see them at the beginning or end of their shift. And, you know, they're able to have that one-on-one conversation. So I think our staff feel really well supported that way. You know, through COVID, that's been stepped up even more because the managers are constantly on the units doing IPAC audits and all of that kind of thing. So questions are answered like immediately, you know, rather than waiting for a once a month departmental meeting. And at the very beginning, we were doing lots of Zoom meetings with our staff just to check in. How are you doing? Do you have any questions? Do you have what you need? You know, that kind of thing. And then fast forward to when somebody leaves, if it's other than, you know, a retirement, we ask them why they're leaving through a survey. And, you know, if there's something that we could have done differently, would it have changed your mind? That kind of thing.
Yeah, that's a good point. Exit sort of interviews. We tend to mail ours out as opposed to do them in person, and I do find that typically I get, you know, a pretty good response rate with those. And I would say we approach it the same way, not retirements, but those who've, you know, chosen to move on for whatever reason. So.